So as Governor DeWine said, we are doing an order today. I think it's very, very important. We've known all along that nursing homes were going to be a very high-risk place for us in Ohio, as it is everywhere around this country. Once again, similar to our prisons, we have some great leadership who've been working all along. We don't talk about it every newscast or every press briefing here that we have, but we've had teams working tirelessly on all of these topics all along. I want to tell you more about it. First of all, our prisons have been under the Director Annette Chambers-Smith, who's really a renowned expert in healthcare and prisons. And we don't just work alone in this. We work with all our sister states, with the federal government, with the White House, on trying to make sure we're always doing the best practices. It is an evolving disease. People have had to work hard against shortages, like shortages of testing and shortages of PPE. That we are doing the very, very best we can in these hard areas. We also have Directors McElroy, or Sal McElroy, who you've met before in aging, and Director Maureen Corcoran, who's our head of Medicaid. They've been leading strike forces along our medical directors, Dr. Mary Applegate, Dr. Mark Hurst, and alongside our Bureau of Infectious Diseases. So whenever there's an outbreak in a high-risk area like this, the local health departments work alongside those facilities to do that very basic disease investigation that we did in the beginning. You test right away, you see who is in contact. And we've been working with guidance for weeks now, really, on how to best make use of scarce PPE, how to keep that from spreading in your facility. But we know these will be our hot spots, and as we move forward in the months to come, these are areas that we have to keep close tabs on. And again, this is work that we are doing day and night. We're working alongside the industries and all the leaders in it. I want to again do a shout out to the people who work. The staff in these settings are truly the heroes. They work tirelessly day and night on behalf of the people we love, and we want to do everything we can to protect them. So similarly, we've been collecting data. It's been in our charts all along about the percentage of cases that we see in long-term care facilities, and we are going deeper than that. We will be sharing with you the names of these facilities, but I want to tell folks, proceed with caution. It's really, really hard. It's not the fault of a nursing home. Most nursing homes are doing an outstanding job, but it is the fact that this disease is so contagious, and as even workers or caregivers come, even as doctors were visiting these nursing homes, any one of us could asymptomatically be carrying this virus from the community into a place like this. That's why we have so many of the rules in place. But it's so important to know that once we recognize it, we do everything possible to control the spread of infection. And these facilities are working very tightly with all our hospitals as well. So these are new partnerships that have been formed. People are not competing. These are not competing businesses like they might have been in an era before this. Everyone is all hands on deck working as best they can. But I want you to know it's very important, especially to the media, when a nursing home has an outbreak, when we report this, there's a lot of stigma, there's a lot of fear. If you remember back to one of the initial nursing homes that had an outbreak in the Dayton area, we had food delivery trucks who wouldn't even drop off the pallets of food to the nursing home. This isn't what we want to create. We want to create, once again, do 5 each day, just like Director Chris said. We want to reach out to these facilities. We want to give them our love and our support. They need us now more than ever. So I just think it's really important as we look at this data, it's not a blame game. We've really got to get away from that. This is about how do we help game? How do we do more? How do we do better with what we have? And that's what we're deeply committed to, and that's what the governor is deeply committed to.